Hi, this is John Colo with OKRaw.com. Today we have another exciting episode for you. Today, I have a special treat for you. I'm sitting down with my friend, Dr. Jeff Pierce, who's a family medicine and lifestyle medicine doctor. And he has been for many years now. And we're going to sit down today and have a chat, right? And, I want to try to get across my personal opinions and also, of course, a professional doctor's opinions on, seeing a doctor. I mean, I know there's a lot of people in the whole raw foods movement in the community that'll say you could heal every disease through what you eat. If you eat all raw, that's going to heal all your ails, right? And we're going to find out from our medical doctor if that's true or not. And we're going to get into a lot of other topics on how I believe, yes, a medical doctor can be helpful in your toolbox arsenal to build your health up, okay? So, Dr. Jeff, you want to give some words of wisdom real quick on your background, why you got into lifestyle medicine, which is a very important topic. If you're not aware of what lifestyle medicine is, link down below to my video I made last time with Dr. Jeff when we go into it in detail.
Sure. Thanks, John, for coming by and chatting today. So, yes, I'm a family doctor originally by training, went through college, med school, residency training, and then some years later I went back and I got even more training in something called lifestyle medicine. And lifestyle medicine is a newer area of medicine, which is really a great and powerful way to approach health, where we focus on eating well, predominantly or exclusively plant-based diet, getting daily physical activity in, making sure that we're getting restorative sleep, that we're focusing on stress, that we have a strong community, and also that we are avoiding toxins as much as possible. And it turns out that when you focus on these, what we call pillars in lifestyle medicine, that we can avoid a whole lot of conditions that are a major cause of illness and death in America and around most of the world. And even more than just preventing and avoiding these conditions, we can even treat them and sometimes reverse these conditions. Things like high blood pressure, diabetes, heart disease, and even some cancers. So a very powerful way to approach health, and I'm happy to be talking with you today.
Thank you, Jeff. So the thing is this, Jeff. There's some people in raw foods will say if you just eat raw, you're going to heal all your diseases. Now, as a medical doctor with a lot of experience, what would you say to somebody that would say that to you?
Yeah. Well, I would say that so many diseases that I see that patients bring either to the clinic or into the hospital, so many of these conditions are caused by an unhealthy diet. And even though in med school, a lot of us don't get training in the benefits of a healthful diet, but through lifestyle medicine, some extra training, we learn more about this. And so if you're eating a healthy, well-balanced, raw food diet, you're already ahead of so many folks in the United States by avoiding, unhealthy fast foods and saturated fat laden, corn dogs and all these other things that we have been shown to be associated with colon cancer and heart disease and stroke and high blood pressure, several other conditions. So I'd say already you're ahead of the game. But the statement of, as long as I eat this way, I'm going to avoid all conditions, or if I have a diagnosis, I'm going to be able to make it all right 100% of the time. I wish it was true, but unfortunately it's just, that's not true.
So, Dr. Jeff, what conditions would you say can be helped by diet, and then what other conditions in general maybe can't be helped by diet?
Yeah, that's a great question. Well, one thing that immediately comes to mind is diabetes, particularly conditions like prediabetes and type 2 diabetes, where, most of us in our training are told, okay, try this pill, and if this pill doesn't work, add this pill, and if those two pills don't work, add this third pill and some injections of insulin, and then this person will be able to live with it. But it turns out that by staying active and eating a really healthy, low-fat, plant-based diet, we can reverse prediabetes, so you never get type 2 diabetes, and even people who have type 2 diabetes many times can see it go away, where they stop using the insulin, they get off all the medications. It's really, really powerful. And so that's the first one that comes to mind. And it's something that if you had asked me 15 years ago, is diabetes reversible? I would have said, no, unfortunately, you just got to live with it. But that's changed. And a lot of docs are coming around as the research has spread the word on how powerful lifestyle can be. But if you told me, I'm having a heart attack right now in this moment, and this was actually, I'm going to paraphrase Dr. Dean Ornish, who's a well-respected doctor in the field. He said, if someone's having a heart attack in front of me, I don't give them a bowl of kale. I'm going to take them emergently to the emergency room where a cardiologist can put a stent in the blood vessel in the heart to save that person's life. But when he gets through the procedure, or she gets through the procedure, then we're focusing on that bowl of kale so that we never have a second one, for example.
Great. So here's another thought that comes to mind, Dr. Jeff, is that a lot of people out there think, if you just go to the doctor, they're just going to give you a drug and it's never going to heal you and you're always going to have to take the drug for the rest of your life. So, how would you talk about this in terms of lifestyle medicine? Like, do doctors always give you drugs as their treatment? Because literally that's what you guys learn, right, in med school, right?
Yeah, no, that's a great question, and it's a common concern that a lot of folks have. I think we are in allopathic medicine, in Western medicine, a lot of times very pills and procedure focused. And where that works really well are those what we call acute conditions, the heart attack, the stroke in the moment, the bacterial pneumonia. These acute conditions do quite well with a lot of the modalities that we have in health. So I don't particularly want to take antibiotics if I don't need to, but if I have a life-threatening, infection in my lungs or a life-threatening skin infection, for example, that could spread into my blood, I'll take the antibiotics and then, go from there. What we're not great in doing with Western medicine is dealing with the chronic conditions, several of which we've already been talking about today, like the high blood pressure, the diabetes, and the high cholesterol, for example. Unfortunately, a lot of our treatment is focused on here, just take this pill for the rest of your life, and it will help to sort of mitigate some of the damage that you're doing to your body on a daily basis. Whereas I think let's have those pills as a plan B or maybe a plan C or D, but the main focus is like, all right, let's just see, what did you eat for the last week? How many times have you put the running sneakers on and gone out for a brisk walk or a jog, and really getting to the root cause of the thing. And so, if you come and you say, doctor, every time I hit my hand with this hammer, it really, really hurts. So instead of just giving a Band-Aid and some pain pills for the hammer injuries on your hand, let's take the hammer away and do something a little bit healthier and smarter.
Yep, I'd agree with that. Now, here's the thing. I think that doctors have some amazing diagnostic tools to kind of figure out what's going on inside you. And so, for example, I'll give it like a scenario that happened in the raw food movement. There's a raw food guy out there that basically had some issues, and he tried to heal his issues through fasting and doing all these different things. And then the condition got so bad that he was almost going to die and had to get hospitalized. And then the doctor said, we got to take out your colon. And then he got his colon taken out, right? Now, like my personal opinion, and I want to get Dr. Jeff's opinion, and we don't know the exact situation that happened, of course, right? But instead of just trying to do it himself and heal his body naturally, if he would have, for example, went to the doctor way before when he started having some initial signs of something going on, something amiss, right? The doctor would be able to better, say, hey, this is probably what's going on with you, and they could give you a, recommended treatment plan. And know whether you want to follow that treatment plan or not. If you follow that treatment plan, maybe you could get rid of whatever is going on with some one-time use of antibiotics, right? Once you're done with the antibiotics, then get back on your track. Some conditions will require, in my opinion, medical intervention to heal you. If you get in a car accident, man, you don't want to go home and water fast to heal from it, to like heal your bones up and all these things, right? I don't think that's going to help. Maybe, so Dr. Jeff, let's talk about can the medical system and all the diagnosis tools really be valuable to help people, find out what's going on with them and then figure out their best course of action for their health in the long run without trying to get too dogmatic and I just got to stick to water fasting or dry fasting or juice fasting because it heals everything.
Yeah, well, knowledge is power, and we have a lot of knowledge about the health benefits of a healthy diet and of fasting, but another part of knowledge is trying to figure out what's going on with your body in the moment. If something's gone awry, if something's gone wrong, and you've got bad belly pain, go to the doc. Get the recommended ultrasound or CAT scan if that's what's necessary, and then that will give you, it's another piece in the puzzle as you are figuring out what's the best course of action in discussion with your healthcare provider. There's a lot of great information on the internet, and a lot of people are and a lot of great books out there, and we've got a lot of knowledge in some areas that perhaps the non-doctor 100 or 200 years ago didn't have. So there are a lot of things that we can do to help cure ourselves. I mean, our bodies are made to cure themselves, but we need help sometimes, and you get that help from someone who has dedicated hours and years of their life to figure out these subtle things that's going on with the body. There are very helpful providers of all types, so maybe you're nervous to go to the emergency room because you figure, they're just gonna recommend one thing. Well, maybe if things are stable and it's not an emergency, call your integrative medicine doctor, your sometimes they're called complementary doctors or naturopaths, different sorts of practitioners out there who can help you go down the path of figuring out what's going on. And then you've got somebody else's opinion, a trained professional's opinion to help you, and they'll say, you know what, this is totally something that's early and we can work on it together, or you know what, this is to the point to where it's beyond something that you can do at home or that I can help you in an outpatient setting, is you got to go to the hospital. And try not to be the person who is making all of those decisions on your own, especially if you're not feeling well. You might not be making the best decisions.
Yeah, I mean, it's like if your car was messed up, right? Would you just it's my air cleaner, and then you fix it, but it's really like an oil pan leak and your camshaft is messed up, right? You're not going to know unless you take it to a mechanic who specializes in, car repair, right? A doctor specializes in the repair of us, right? And so I want to encourage people. I mean, I do regular blood tests and I get regular medical checks. I get regular microbiome tests to kind of see where I'm at. And then once I got the results, right, I just got a recent blood test, paid $800 for all different kinds of blood tests just last month. I could check in to see where my B12 is at, where my vitamin D is at, where my calcium level is at, where my potassium level is at, where my white blood cell count is at, where my thyroid numbers are at. I think my PTH was 5 points too high. But I could see what's going on, and then I could this is high. Let's figure out, maybe consult with the doc, or try to figure it out myself. And if I try to figure it out myself, I do some things and it doesn't help, and I get my next test, it's still high. Then guess what, John? What you didn't work. You better see somebody professional like Dr. Jeff, who really knows what the hell's going on, so that he could, provide me some guidance. And there's so many different health markers. So, Dr. Jeff, what would you say about getting some proactive health testing, right? Like blood tests, like microbiome tests, or any other tests that you would recommend that could be helpful for people. I got a DEXA body scan to see my visceral fat, which is another pretty important indicator in my opinion. But what are some tests that some people could do on their own, and use some of the data they get and actually even work with their doc, if they have one, to get their numbers more in line so that they can be healthy and once again avoid, major problems in the future, because if you go B12 deficient for a long time, you could have some really irreversible damage.
Yeah, that's a great question, and certainly B12 is one that's high up there in a number that you should check, because in a vegan, since we're not eating the microbes in the soil that used to give us the B12 a long time ago when we ate less cleanly, we take it in supplemental form, whether it's a daily pill or a weekly pill. And so you got to stay on top of the B12 level. I mean, so for basic labs, I think it's a good idea to know your B12. Some folks want to make sure that they're not anemic. That's typically called a CBC, or a complete blood count. It'll also look at your white blood cells and your platelets. That's pretty routine, something that you would get at your annual health check. If you have any concern for how well your kidneys are working or how well your liver is working, then a basic metabolic panel or a complete metabolic panel are also very common and usually very inexpensive tests to get. And as you're talking with your healthcare provider, that's probably something that they would check once a year for most people. Some people would also get their thyroid looked into, and the screening test for that is called a TSH, and that's a pretty simple one to get. And if it's out of balance, then there's some follow-up tests that could be checked. We talked about the B12. Some folks are very interested in finding out their vitamin D levels. Excuse me. Other folks say as long as you are supplementing in the winter, if you're away from the equator, if you're supplementing with vitamin D pills during the winter and then getting out in the sunshine for the rest of the year, you'll probably be okay. But other people want to make sure they know it, so that's a test that's pretty straightforward to get. And then I think a big one is a cholesterol check and a diabetes screening check, because having high cholesterol is an asymptomatic condition. So you just you don't feel that you have high cholesterol. And the reason why it's important to know that you have high cholesterol is that's one of the main risk factors for going on to have heart disease. And heart disease is the leading cause of death in the United States. Same thing with pre-diabetes. Check in what they call a hemoglobin A1C, which is a 3-month average of your sugars, or a fasting sugar where you don't eat or drink anything other than water since the night before. You get your blood checked and you see what your blood sugar is in the morning. Those are great screening tests that most adults should have. High-risk people are going to be getting them every year, and lower-risk people might just need them every 3 years or so, but it depends, and you should be talking to your healthcare provider about that. And I want to tag on one thing to that, John, that you had mentioned about going to your car mechanic when there's a possible problem with your car. You know, many of us have gone to a car mechanic that we say we're never going to go back to. You know, he or she, charged us for everything, things that we didn't need, and we didn't even like how they talked to us or whatever. So it's understandable. You can choose a different car mechanic. The same thing goes with a healthcare provider. Is if you go to a doc and they berate you for being vegan, they berate you for eating raw. They say, oh, it's only going to lead to, disease and dysfunction, and they don't have time to listen to your story. That's too bad. Time to go check out a different healthcare provider. We're lucky enough to be friends with Rick and Karen Dina. They're a couple of experts in the field. Those would be great people to talk about for raw food nutrition. But there are also other types of healthcare practitioners who don't quite have that level of knowledge, but they're at least willing to listen and to work along with you, right? And that's the kind of provider that I hope to be with my patients, and that you should find for yourself.
All right, so in many states, you actually do need, to see a doctor to get actually blood testing done. That being said, I found a way around this, of course. And so there's a few websites, like Jason Health. I think it's drsays.com also. 2 websites where you could actually go request a blood test order, then a doctor will review it and just basically approve it. In most states, there's a few exceptions. And then you could get your blood test for actually really inexpensive. So I'll put a link down below to my video where I share about how to get literally as low as $5, like a CBC or a standard panel test. Of course, there's a blood draw fee and some other things, and I think the price gone up after the pandemic. But you can get blood testing at home without necessarily going to a doctor and spending a lot of money to see a doctor just on your own. And then the companies will also, if you have some things that are way out of range, they also may consult with you to check in, because it's their duty, because the doctor ordered the test, to basically make you aware of things that are just really out of bounds. So I have used those services before, and that's how I continue to get my blood test to this day, and I could definitely recommend it. So don't be scared of getting some blood tests. Link down below for that. So another question I have for you, Dr. Jeff, is what do you consider a balanced raw food diet? Because you mentioned earlier, if you have a balanced raw food diet or balanced plant-based diet, you know, it could be perfectly healthy and you could heal from many, but not all conditions.
That's a great question. So let me start with a balanced plant-based diet in general. This is where most of the folks that I work with, most of my patients are coming from. You know, we talk about hitting the 7 food groups. I think of vegetables, and fruit, and whole grains, and legumes, and nuts and seeds, and herbs and spices, and mushrooms. And so by eating freely from those 7 categories, your intestinal microbiota will have a heyday of just the best variety of fiber and healthy minerals and vitamins and antioxidants and phytochemicals, etc., to keep you so healthy. And of course, so many of those things that we just mentioned are deficient in the diet eaten by the average American. Raw food diets a little bit different because, you know, probably less in the way of legumes being consumed. I have, you know, I'll be honest that I am not an expert in someone who, say, just wants to be fruitarian and just wants to, you know, eat nothing but this. I would say if I was working with someone who's coming from that standpoint, I'd say, okay, well, let's make sure you're not just eating apples all day and that there's a variety of fruits within the diet, and let's also check some labs, see how things are going with some of the things that we've talked about already when we're talking about our labs. But I'm a fan of eating from the rainbow, and so this is one thing that a lot of raw foodists do so well, is that, you know, it's not just a green salad with nothing but iceberg lettuce in it, right? These are some of the best salads in the world, where you've got the shredded carrots and the shredded beets and the all sorts of greens of, you know, from 7 different plant families or something in it, and some sesame seeds on top, and some I just had some pomegranate arils in my oatmeal, for example. So such a great way to do it. I think there's a lot of evidence also. I know we've been talking just now about fruits and vegetables, but whole grains, and an easy way for people who are eating raw to get whole grains would be in the form of rolled oats, where you just you can add milk and let it soak in, for example. That's still considered raw.
Like almond milk.
Oh yeah,
not dairy milk.
All my life is so plant-based, I don't even differentiate, because it's assumed that I'm talking about plant milk. But yes, soy milk, almond milk, rice
soy
milk.
Soy milk's not raw. You can make your own nut milk.
Okay, there you go. Thank you very much for keeping me straight there. Or you can make your own oat milk, of course, in about 30 seconds in the blender. So different ways to get your grains in as well. But I would just try to keep things as varied as possible, because studies have tended to show so far that the more varied our diet is, the more variety we have in the different kinds of fibers that are getting into our system and down into our colon, is what leads to the healthiest microbiome. And a healthy microbiome means a healthy human being.
Absolutely, I would definitely agree with Dr. Jeff on that. A healthy microbiome leads to a healthier human being. And for me personally, I mean, that's what my channel is about, is trying to diversify the raw food diet. And for me personally, I started eating small amounts of heat processed food to even go even greater to diversify my diet, because I believe it is beneficial, and I have seen the positive effects of diversifying my diet, from my overall bacteria count going from 750, 850 up to 950 now. So I increased it like almost 25% by increasing the types of foods I was eating, instead of restricting them only to fruits and vegetables and nuts, right? So I want to encourage you guys to watch some of my other videos on how you can incorporate resistant starches if you still want to maintain the raw label. Link down below to that video. I have videos on prebiotic, some of the best prebiotic foods you could eat if you're raw vegan. If you want to stay raw vegan and not start eating heat processed foods, I'd recommend highly you check out Raw Food Romance Lissa, who recently shared her recent microbiome test with me, and I'm quite impressed. It's the highest I've seen of any raw vegan. And so you want to get her wrap book specifically because she formulated her wrap book to have all different kinds of different ingredients in there. So now when you're eating your wrap with shredded vegetables and a really good tasty sauce in there, you're getting all kinds of prebiotic fibers, and most raw vegans don't take the microbiome into consideration when formulating their recipes, right? So this is so huge. I mean, I'll have a video soon actually on how to incorporate more beans in a raw vegan diet. You can sprout them. Some kinds of beans, of course, some kinds of beans should not be sprouted and eaten because they can kill you. So I personally these days heat process my beans, soak them, and then pressure cook them is the best way I like to eat them these days. And of course the mushrooms, while some of them can be eaten raw, I do recommend you heat process those as well. And that's what I do for my mushrooms, and I eat a variety of mushrooms. I mean, you could go to the Asian market and find so many different kinds of mushrooms and increase your diversity so much with chitin fiber. So Dr. Jeff, one of the classifications that you did not get into that I was surprised to see missing is seaweed. Where do you classify seaweed? Is that an important part of a plant-based diet due to the iodine content? Because hopefully people on a whole food plant-based diet are not eating iodized salt, and if you're on a whole food plant-based diet, you're probably not eating things that are fortified with iodine either.
Yeah, that's a good question. Well, I lump the sea vegetables in with the vegetable category, but it's a very important group to bring up because there are differences in terrestrial vegetables and in sea vegetables, and iodine being one of the big ones. And I agree, folks who are eating very healthily, who are salt, oil, and sugar-free, can become deficient in iodine. And of course, that's part of the reason why, to avoid deficiency, why the U.S. government had helped create the iodized salt idea decades ago. But so for those people who do eat salt, a little sprinkle of iodized salt can do it. You can also take 150 micrograms of or close to that of iodine in as part of a multivitamin or as a capsule by itself, or getting it from the source, which is probably the best way to do it. Nori, seaweed sheets are a great way to get iodine because they don't have excessive amounts. There are some, kelp tends to be quite high in iodine, so you do have to be careful with large doses of kelp. And I think it's hajiki, which is one that can be high in, I believe it's arsenic. It's been a while since I've thought about that. So do get to research a little bit about the sea vegetables that you're eating. But a sprinkle of kelp or nori, wakame, I believe, is another one that's a pretty good source. Definitely include those because they are bringing different things into your diet that you would get that you wouldn't be getting if you're just having terrestrial vegetables.
Absolutely, Dr. Jeff. I mean, I would say I'm going to have an upcoming episode, hopefully one of these days, on seaweed specifically because I believe in it so much. I mean, it doesn't make a large part of my diet, but it does make up a part of my diet that I feel is essential, not only for the trace minerals like the iodine, also other trace minerals that wash into the ocean that are not in the land anymore due to soil erosion and farmers not putting trace minerals back in the soil like I do in my garden. But more importantly, it has other different kinds of phytonutrients, growth auxins that are good for actually growing plants, with also has unique kinds of fiber that are not found in plant foods like the fucoidan. I think that's a type of fiber, and they've doing a lot of research on these kinds of things in Japan. And if you guys have already researched the healthiest seaweed to get, that yes is raw. I talked to the company, the main distributor in the US that brings it in. It's fully checked out for radiation and heavy metals. And it's actually the raw nori is the brand. Put a link down below my Amazon shop. You can get the raw nori sheets, or what I get also is the raw nori. It's they take the sheets and they just grind up into little flakes, and I'll just put a little bit of flakes into with my salad, my soups, or even sometimes my heat processed vegetables, and just eat it. I don't even know it's there, and I'm getting some iodine as well as some of the other beneficial nutrients from the seaweed. All right, Dr. Jeff, the next question I have for you is another thing that goes around in raw food circles. That's like, they say illness is caused from toxicity, whether it's you got mucoid plaque inside you, or whether you got toxins in you that you didn't get out because you're not absorbing your food correctly and you need to go on a juice fast. And if you're still sick, it's because you haven't cleansed enough. And if you cleanse more, you're going to get rid of all your ails. So, Dr. Jeff, is there medical evidence that, you said earlier that we should avoid toxins as one of the tenets of health, right? Of lifestyle medicine. But does this mean that if we got toxins in us and we need to keep cleansing to get it out, we're going to get sick otherwise? Or is this just a myth that some people out there like to say to kind of basically try to scare you and get you cajoled into doing what they're saying to do, which might not even have any medical backing?
Yeah, that's an important question. I think we live in many ways in a toxic environment. There are toxins in the food. There's toxins in the water. There's toxins in the soil, and a major thing that we can do is avoid those toxins from not putting them into our body. And if we are, so the first step, of course, for someone who has been eating a toxic diet is to clean up their diet. The idea that any ailment can be fixed by a cleanse, that's taken to an extreme that's a bit dangerous. I think there's a lot of good evidence in a water fast or in a juice fast now and again, but a fast and a cleanse won't reverse that heart attack, and it won't get rid of the sepsis, etc. And we want to make our bodies as healthy as possible, so that if we do need an intervention like a surgery or an antibiotic or something like that, that our bodies are going to bounce right back, that we've got a great working immune system. But if we trying to cleanse to wipe everything dangerous out of the body, it can be perilous if you're not getting medical attention before it gets too late.
All right, Dr. Jeff, so let's talk about how the body naturally detoxes, right? We don't necessarily need to go on a juice fast, which although it can assist, or even a water fast to help detox us. Tell us how our bodies will naturally detox. I mean, aren't we designed to detox naturally? If you just start eating healthier, your body's going to detox, and our bodies I'm detoxing right now as I'm sitting here, right?
For sure.
I mean, what's a medical truth, since you've been through all this schooling and all this stuff?
Yeah, for sure. I mean, even if I'm eating the healthiest, cleanest, toxin-free diet, everything I'm eating is covered with bacteria. Every time I breathe, I'm breathing in fungal spores every day, inside and outside. And our bodies, of course, have evolved to deal with this. We don't live in a bubble, in an aseptic bubble. We are exposed to the living environment. And so our bodies have fantastic immune systems that can deal with these things. I mean, if every microscopic organism that we inhaled or ingested could do damage to us, none of us would, last more than a couple of days on the planet. And so we have our innate immune system, which is highly complex and works on many different levels. We've got organs that are dedicated to detoxing, and our best friend for that is sitting under your right ribs, which is your liver. And it has many jobs, but one of the big ones is the liver, along with the spleen, which is filtering out parts of our blood that need to be recycled or removed, and of course all of the lymphatic tissues, our lymph nodes, and the thymus gland, which is in our chest, particularly when we're younger and active, our bone marrow, etc. Our skin, of course, is keeping out unwanted microbes out of our blood system, and so on every level, the hairs in our nose keeping certain particles out of our lungs, and the little cilia in our lungs that bring the particles back up. On every level, we have our own ways to prevent toxins from coming in and to deal with the toxins that inevitably come in. So we can do our part by what we put on our plate and what's on the end of our fork. We can put on our running shoes and go for a run, because that boosts the immune system. There are all sorts of things that we can do to make our immune system stronger instead of weaker. Did we sleep for 2 hours last night because we were trying to binge on all of John's videos? Or did we get that 7 to 9 hours of sleep that most people are going to require to keep their immune system functioning? We do what we can on our end, and our body's innate systems are going to do what it does on its end, and together, hopefully, that means we live a long and happy life.
Wonderful, Dr. Jeff. Some of the data that I've seen suggests that certain plant foods with certain phytochemicals could help our bodies more effectively detox. Is that true or not true?
Well, a big thing that first jumps to my mind is all of the plant foods that are so high in antioxidants, anything that's supporting the immune system, because our cells are breaking down, our cells are getting affected by carcinogens, etc., on a daily basis. But if we're eating foods that are, the dark purples, the dark blues, the bright reds, the oranges, all of these colors are related to healthful compounds that help support our body to fight off infections and toxins.
Yeah, I encourage you guys to eat colorful foods. I choose a lot of my foods based on the colors and their phytonutrients, and I've seen lots of correlations in science. And, so I eat very specifically, not just randomly eating all these bananas that, yes, they have some antioxidants compared to a candy bar, but not as many as compared to some blackberries like I ate this morning. All right, Dr. Jeff, so I want to get down to the nitty-gritty, talk about water fasting, because water fasting is a method that has been used in the raw food community. There's are people in the raw foods community that you could go and water fast with, and I've known some of these people that actually have killed people, so I do not recommend just going to some random person in a foreign country to do a water fast with. I recommend only actually here in Santa Rosa, because I'm in Santa Rosa, to True North Health Center. So Dr. Jeff, what is your opinions on water fasting and its benefits, and can somebody do it on their own, or should they go to a center and get medical supervision, or what would you say?
Yeah, water fasting is pretty fascinating. Certainly didn't get any training in medical school on it, and if you had told me back then about it, I would have said, well, wow, what a crazy idea. But of course, there are centers, like you mentioned, True North, which do an excellent job of approaching it in a very safe way. We fast most of us fast every day. We finish dinner and then we break the fast in the morning. And even having a fasting period of 12 hours can be beneficial, which is much better than having the, late night ice cream at 11 and, having breakfast at 6 on your way, on your commute to work. You want to try to at least fast for 12 hours, but maybe 14 or 16 hours of a overnight fast on a regular basis is better. But then when you're looking at these prolonged fasting, where you're talking about 1, 2, 3 days, up to even 40 days, like some people have done, that absolutely has to be in a medical setting. And Dr. Alan Goldhammer and the very smart, hardworking folks at True North, for example, do this day in and day out. And they are going to be seeing you, if you're checked into their place, they're seeing you twice a day perhaps, checking your blood if necessary, checking your blood pressure, of course, because blood pressure drops precipitously on a water fast, and that's where some people get into trouble is they keep taking their high blood pressure medication, they're water fasting at home. On day 2, they get up out of bed in the morning and they fall and hit their head because they're hypotensive. So the water fasting, if it's at all prolonged, just needs to be under medical supervision, and you will see a whole host of possible improvements, including how your sugars, how your blood sugars are, and how your blood pressure is, and other things like that. So yes, I'm a fan of fasting. We just have to be smart about it. And there are other things coming out, like a fasting mimicking diet, which is some of the work that Walter Longo out of University of Southern California has been doing, and his products, a lot of fascinating stuff, and that's something that can actually be done at home for many people. So yes, I'm a fan of fasting. We just have to be careful with it.
Wonderful. All right, Dr. Jeff, so I think we're getting to the end of this episode, but I want you to leave my viewers today with some words of wisdom about using medical doctors to our advantage as a tool, right? We are literally hiring a doctor when we go to see him, like you're hiring a mechanic, right? You could check reviews on the doctors and see if they're good reviews or bad. Choose not to go to the doctor. but I don't want you to leave doctors out of your arsenal because they can play a helpful role in your health journey, right? If you have a chronic condition that's not going to, well, you've tried juice fasts, you try what these internet gurus say that has no medical training or knowledge, and they probably don't even look up a lot of studies like I do, right? Go see a doctor. This could save your life, guys. This could save body parts before you get too damaged because you tried to do all these natural things, which, hey, natural things are great too, but you have to respect the doctors in many cases, know what they're doing because they're experts in the field. So what words of wisdom do you want to share, Jeff, with everybody?
Sure, I agree with you, John. I think just to recap some of the things we've said, remember, you have the final say after you get the information from your doc. So you've got the chest pain, you go in, you see your doc, they say, look, I think it's A, B, and C going on. And then you can think about it. You can say maybe you need a little bit of time to think about it as long as it's not a true emergency. But it's still your body. And that's one of the things that every medical doctor is trained in is that we have to respect the patient's autonomy, the patient's decision. And so knowledge is power, and get that opinion and then see what you want to do with it. But don't, I encourage you not to stay at home and be afraid that they're going to, just recommend a pill or procedure. That may or may not be true because you might have found a great doc who also focuses on lifestyle, for example, in more natural ways before going to the pill or procedure. But then B, sometimes the pill or procedure is what's going to save your life or your limb. And it's going to allow you to continue to enjoy those walks in the forest and those colorful salads for decades to come, instead of having your life end early because of a fear that was keeping you from appropriate care.
Yeah, I mean, the other thing I'd say is that you could also, like I did as a child, my parents would do, and probably still do these days, you get more than one opinion from a doctor. If I went to Dr. Jeff, he might say, John, this is what's wrong with it. But I go to another guy, he might say, oh, the same thing's wrong with it. Or he might say something a little bit different. And then you go to another guy and kind of like see what they all say. If they all say the same thing, chances are they're probably right. Now, if they all say different things, well, then maybe you got to go to a specialist that really knows about that specific condition, and I probably would trust him more. And then once you have the knowledge, then you could choose what you want to do. If you want to, okay, I know this is the problem. Now I'm going to try to heal it naturally for, if it's not a serious issue, I'm going to try to heal naturally I'm going to give it a month or two working with your doctor if he's going to work with you and say, hey, doc, I'm going to try to work on this naturally. Will you help me? Hopefully he'll say yes. And if not, find another doctor that'll say yes. Try to do it naturally. And if it doesn't work and it continues, right, then it might be a good thing to, go with their treatment plan or find another alternative doctor with a treatment plan that you would more agree with than the more maybe invasive treatment plan. I don't know whether it's surgery or drugs or whatever your condition is, right? But I want you guys, once again, the reason of this whole video is I know there's people out there that are avoiding their doctors because they're scared, right? And there's some teachings in raw foods, in my opinion, some camps that are not accurate, that we could heal everything through raw foods. That is not accurate in my opinion. Dr. Jeff's opinion, go see a doctor. They can be helpful. Use the knowledge to your advantage. Maybe do their treatment plan, maybe not, but you have to get the proper diagnosis to know what's going on, and so that you could have the best health outcome, because that's why I got into leading a raw vegan diet, not so I could say I'm raw vegan, but for my health, because here in Santa Rosa, I almost lost my life many years ago when I was younger, and I'm like, I need to get out of this hospital, and I need to never come back. And, that's what I thought back then, but nowadays, hey, now I know that, hey, hospitals and doctors can be beneficial if there's a situation that, is not able to get healed naturally. And there's a lot of those out there, guys. So not everything is going to be healed by diet. Many things can be prevented or healed, but not everything. So, yeah. And then, Dr. Jeff, last question is, how can somebody find a cool doc like you? I mean...
Yeah, well, thanks for asking, John. I work with a great group of docs. We're called Love.Life Telehealth. And we cover, the United States with between the 10 or 11 of us. And if you check out the website, I'm sure John will put a link to it. You can find a doc in your state that you can come see for a half hour, for a whole hour, and work on anything you want to talk about, basically. So that's a group that I would recommend. I would also my family would see any of us in this group. It's a really great group of people.
So they're all like lifestyle medicine and plant-based docs, so they would understand people on this style diet?
Yeah, definitely.
Wonderful. Yeah, so I'll put the links down below in the description. So if you're looking for a doctor and want to have an easy way, and I mean, it's all telehealth, so you don't even have to go to the doctor's office and get the white coat syndrome or nothing like that, right? Just talk to them. At least they could get you moving in the right direction, get you diagnosed, so that once again you guys could get healthier without all this dogma that is appearing in online social media, unfortunately. All right, so if you guys enjoyed this episode with Dr. Jeff Pierce and want more videos with Dr. Jeff, please be sure to give this video a big thumbs up. More importantly, please guys, share this with other people in the raw foods community that basically try to fear you out of seeing a doctor, when in some situations they can be quite helpful. And I would always encourage you guys to have them, just like a juicer is a tool in my kitchen to allow me to juice and get healthy by juicing vegetables predominantly, right? Doctors are your friends. They are a tool in your health toolbox to ensure that you can lead a long and healthy life for many years to come. So don't forget it. Also, be sure to click that subscribe button right down below so you don't miss my new and upcoming episodes. I've come in every 5 to 7 days. You never know where I show up or what you'll be learning on my YouTube channel. Make sure you click the little bell to get notified as many videos come out. And finally, be sure to check my past episodes. The past episodes are wealth of knowledge. Over 700 episodes at this time on this channel dedicated to teach you guys all about how to eat a healthy, raw, plant-based diet. Link down below to my video that I made with Dr. Jeff when we talked about the lifestyle pillars of health. Because health is a lot more than just the diet, which is one of the many pillars. Check out that video as well, and I want you guys to start doing all those pillars to take your health to the next level. So with that, my name is John Kohler with OKRaw.com. We'll see you next time, and until then, remember, keep eating your fresh fruits and vegetables and diversify your diet. It's going to be the best.